I told you earlier on that we're going to have a guest on the show this morning, and it's the president for the Health Promotion Foundation for All. She told me it's called HPFA. All right, so you have to stay tuned and don't move a muscle. She's called Nkongho Achere. I hope I got the name right. By the time we come back, she's going to tell me if at all I pronounce everything properly. Up next, our guest on the show this morning. Yo, welcome back, and if you're just tuning in, it's Elelagbam, okay? And we are 1 hour 30 minutes gone. And like I said, we have a guest on the show this morning. She's the president for Health Promotion Foundation for All, HPFA, like I said earlier on, and she's called Nkongho Achere. No get English name, just all the chong, ching, chong. Anyway, good morning and welcome to the program.
Good morning, Miss Fade, and thank you for having me here.
Oh, it's a pleasure to have you. So, Health Promotion for All. Health Promotion Foundation for All, HPFA. What is this foundation about?
Okay, as the name goes, Health Promotion Foundation for All. We are actually here to promote health, particularly in rural communities. And in doing so, we tend to enhance health equity in these rural communities.
Okay, so health equity. And you target mostly communities.
Yeah, we target mostly communities. And when we talk of communities, a community can be rural, it can be urban, but we have particular intentions to go for the rural communities based on the needs of these communities. Most of them are the ones suffering a lot from most of these health problems.
Okay, that's a good one. Now, it's not just rural communities, urban as well. I was almost getting dumb. When we hear community, there's this tendency that we think of rural. So let's talk about the services that this foundation offers. What do people do in that foundation? Because I have lots and lots of them. We have so many foundations. What services does this foundation offer?
Okay, I'll go further to talk about what makes HPFA unique. We have this tendency of having most health organizations out there. We tend to bring in, host seminars, we just go talk and then we leave without creating an impact. So what HPFA does is that we target rural communities, for example. We tend to work with them for 3 months. What do we do during this moment? We have to go to the health center, the nearby hospitals around there. We tend to get data on the most prevalent diseases that these people are suffering from. And then by doing so, we now move door to door to educate these people. But aside doing that, we also tend to do some level of assessment, because what is happening in the hospital might not be what is going on in the community. So by doing so, also have some of this prevalence. And then we involve the community members. That is why it is called health promotion. We involve them to carry out these health promotion activities. We engage them. This helps to improve their ownership and their responsibility too. So when we're not there, they can continue with most of those activities that we're doing there. We do the one-to-one contact, door-to-door, working with them. Yeah.
All right, door-to-door. That's a lot of impact. Many people watching you be like, okay, president for Health Promotion Foundation for All. Is that the young girl? She's so young. She looks so small. Why is she a president in the first place? I don't know how that bigger all that people that can be in this foundation. How come you're a president?
Okay. I'm actually the founder of the organization since an NGO, and because I started the foundation as a radio program, most of you have actually listened to me talk, educating communities about some problems on FM 92.1 Radio Bunakanda. So this is just an expansion of the program, and as a founder, I just had to take the role of the president.
Okay, that's normal. We understand. So how old is HPFA?
Okay, from the radio program to now is actually 2 years, but officially it's been less than a year, because when it concerns health, you have to go through some procedures, legalization, so that they know that no, you're actually out there to help these people in the community. You're not there to give out wrong information to them.
Okay, that's a good one. So let's talk. You say you're officially it's less than a year.
Yeah.
You're less than a year old. So in this short period of time, how many communities, how many people, let me put it this way, have you been able to reach this young foundation? How many communities have you been able to actually say, okay, we've gone here, we've impacted these people, we've done this here and here?
Okay, we've actually talked a lot. We've worked with Bonakanda and Bukova actually, but basically with the radio program. But at the moment we're at Munia community, so we're working there at the moment, and we really look forward to helping these people. You know, the population there is really high, it's really very difficult, but we tend to see whether perhaps we can help them as well. So at the moment, since we have an estimated population of 20,000, we've already walked through so many quarters. We've talked to some few organizations, and we also look forward to going to churches.
Oh, churches.
Yeah,
that's a
certainly.
good one. Okay,
Certainly.
so you're out there to give your all, give your services, promote health, and there is what reaction do you get from those you go to reach?
Oh my God, it's really overwhelming, because when you're there, the person feels, you know, when you go and knock at somebody's door and you're like, good morning or good evening, and then you introduce yourself and you talk about the fact that I want to preach health to you, I want to help you, and then they're like, how come, are there people in this Cameroon that can turn out to just help without getting any reward? Are there really people like that? And we're also working with the head of the Munya community. The chief is not well at the moment, but we have Mola Elinge that is working with us, and he's really amazed at the fact that we can come out, because we have just a majority of students, we have public health students and a few other persons, and they're just there to help out without actually having any form of payment. So they're really very happy, and they encourage us so far.
All right, so we're happy that you're getting the feedback necessary. Let me put it that way. Do you have major people, other people lending you a hand? Because when I look at you, I'm tempted to ask, in fact, how many of you are in that foundation? Let's say active members, okay? How many of you are there?
Okay, at the moment I will say 37, and to tell you the truth, most of them are volunteers. We have just 7 official members, and then the rest are volunteers, because we really need to see your commitment. Well, there we have a vision, we want to help people, so we really need to see you volunteering with us, helping these people in the community before we can make you an official member. And to tell you the truth, because of what they saw, they are coming in many numbers. Like yesterday when we're having the meeting, we also have new members coming in. Everybody's like, wow, we really love this, we want to help people in the community, especially when you get most of those positive feedbacks.
So nobody gets threatened like, okay, I don't know why she's receiving orders from this young girl. She's too young. She's a lad. You know, she's not like she's a woman. So are people not threatened by your?
Well, I thought it would be so, but you know, when it comes to human management, it's really very difficult and tactful. You really need to know how you engage with people individually based on their personalities. I really don't face that problem. Sometimes I instead get feedbacks like, you really inspire me and stuff like that. So instead they motivate me. They're like, I'm behind you, really want to do this. Especially when they've understood what you want to do and how much you'll be helpful to people in the community.
Okay, that's a good one. Well, you've heard it from Nkongho Achere. That's the first part of our interview. Okay, we're not going anywhere. Let her catch her breath later. She's going on and on and on. Just to let you know, she's the president for Health Promotion Foundation for All. She said it's called HPFA'. Let's take on this musical interlude. When we come back, we'll continue with our interview, as well as get her view about our talking point for the day. That was to remind you that we're still talking love and relationship on the program, and we're with our guest. We are still with her, Nkongho Achere. Her name is so long, it's a lot of strong country. Then she's the president of HPFA'S. So we've talked a lot about the organization and the rest, but the fact that you're thriving is one thing. What any challenges you've been facing so far? Foundation as young as yours. And viewers, please, we don't take calls, okay? SMS us. You've been ringing my phone since. SMS us right on.
Yeah, we really have so many challenges. The first one, since I had to talk previously about human management, it's very, very difficult sometimes when you've planned something and then everybody is like, wow, this is really good, I'm going to be there, and then at the end of the day we have a few people. But that really does not demotivate us, because the few persons that we have are really, really inspiring, and they want to do it no matter how many people are there. And then another challenge we face is when you go to this community, you really don't know the community very well. You've just been introduced, you talked about the quarters that carried you around, but you don't know the people you're going out to meet. So like sometimes we'll have feedbacks, like somebody will tell you, well, I met this drunkard and I didn't even know he was a drunkard, and then he started saying things, and at some moments it might arouse you. But we try to resolve that by putting at least two persons to go out. When you're going to a particular house, make sure that there are at least two of you. And then another problem too is the aspect of finance. Now when you're out there to help people, you really need this finance. But like I said, what makes HPFA'S unique, we really meet people one-on-one, and so it would be good if we can have other bodies to help us to do this work. Most of the time we have organizations that will stand out, they'll hold these conferences, seminars, out there saying that we're helping people, but they just hold the seminar at once and then they disappear. They don't create any impact. But HPFA'S is here to talk about the real person, to meet the real person and talk about this person, not hold the seminars at fancy hotels where the real person is not found. We're there to work with them. So if you're out there and you really say that this what we're doing is good, then you can come out to help us. But at the moment, we got a feedback from the delegate of public health and also the district medical officer for Boya Health District. They saw what we're doing and they said they really love to collaborate with us to help us to make this really grow.
Oh, we thank God that you are taking that bold step and deciding to help you. They're setting the example, and obviously we hope other people are going to follow the example and help the organization grow. So do you have any upcoming events, anything the public should look forward to?
Yeah, since we're really working at the Munia community and we're having World Hepatitis Day, yes guys, coming up on July 28th. So HPFA will be out there to do a lot of sensitization and create awareness for hepatitis. There are going to be talks, listen to FM 92.1, we'll be educating you all tomorrow Saturday on hepatitis and also the day before, that's the 27th. And we have a few HPFA members that will go out that have been called up by the University of Boya Medical Laboratory Student Association to teach them on how to do carry out basic hepatitis tests, carry out the test, and then they're also trying to collaborate with the Incorrect Hospital to see how they can minimize the prices for the test and also for the vaccines. It's really good. This is something that is killing so many people out there, but there's not much awareness. So please guys, listen and be there. It's really going to help you out. And we're going to have a come together that's for the Cameroon Women's Scholarship. I'm sure some of you have heard about it. So HPFA will be a part of it to go out to the prison to carry out some medical tests. We're going to help others to do diabetes analysis and also to help out with hypertension screening.
Okay. So before I let you go, okay, there's something that really caught my attention. It's your logo. It reads "Health for Wealth, not Health by Wealth." Why a logo as such?
Health for wealth, not health by wealth, guys. This is because, you know, as a layman we say health na money. So most of the time, if you're healthy, then you not spend money in the hospital. If you're healthy, there's no need why you're going to drain down, you know, move from one hospital to another just to spend money. Meanwhile, you can carry out some basic health prevention measures to prevent these health problems. Health for wealth, not health by wealth. And the reason why we added the not health by wealth, like you can see, we have Health Promotion Foundation for All. That is for everybody. It's there for everybody, not by wealth. We go there no matter your status, no matter your economic status, no matter how much money you have, we target you, we're there to help you. So that's why we have the not by wealth.
Alright, so after all this preaching and talking and people getting really excited, okay, I wish to join HPFA, what am I supposed to do?
Okay, to join HPFA, you can we have a Facebook page. You can message us there. It's written Health Promotion Foundation for All. We also have on LinkedIn for those who are professionals and use that platform. We're on Instagram. You can follow us there, but you can message us through Health Promotion Foundation for All, or you can the Facebook page actually, or you can call me. That's 672149606. You can call the number. You can message the number. We have free SMS, and you get us to tell you more.
Okay, all right. So after all this, okay, no, there's this way we tend to reason. If you have said all this and you don't maybe give that small mandy for it to set to be that spark, people will not be able to maybe do whatever it is you've told them to do. So any last words for those watching you right now?
Okay, my last words. You know, everybody out there needs someone to stretch out their hands to. And most of the time, we've heard for people in the health field, we've heard a lot about there's some goals that are set up like Health for All by the year 2000. We have the Millennium Development Goals, and so far in Cameroon, we had just a few. That's not up to 3 that we attained. And now we have Sustainable Development Goals. So if you want to help the community, you want to see these goals being attained, then you should join us to enhance health equity, to reach out to these people in the community. It will really go a long way to help them. And not only that, but you get to learn too, because when we're going out in the community, we have a lot of training programs, effective communication, and based on the community diagnosis that we've had, we educate you on how to target these people, to educate them and how to involve them to carry out some of these health promotion activities. So in as much as you're helping people in the community, I want to see global health, you want to see health being promoted, you also learn a lot.
Okay, so she said it all. I don't know if there's some, please support it, okay? You never know, it's about health. If you're not healthy, the next thing is you're going to die. There's no way. And then this life is joy. You live it just once. Once you're dead, once you're out of it, there is no coming back. So when we see foundations as such popping up. It's only good if you have the means, okay? Lend out a hand. If you don't have the means, at least join the foundation. In one way or the other, you enable it thrive. No be so.
Not so.
Alright, thank you so very much. Nkongho Achere. Wait. Nkongho Achere. Your name is so difficult. Anyway, but I like it all the same. The rhyme. Thank you very much for having been on the show this morning.
Thank you so much, Miss.
And the entire Elagbamu crew and High Television wishes your organization the very best.
Thank you. Thank you.
So each time you think that we can lend a hand, always come to us, okay? Our doors will be wide open.